Cholesterol is one of the things that we physicians screen for on your regular blood checks, and that's how most patients tend to kind of become aware of their cholesterol numbers. And really what cholesterol is kind of looking at fat in the body and in the bloodstream. It's typically dietary fat. Cholesterol can be influenced by a number of different things. Genetics play a major role in what your total cholesterol is in the body. Also, poor dietary habits, eating a high-fat diet, rich in transaturated fats and fatty foods, fried foods play a major role in that as well. When your cholesterol is high, it doesn't hurt. You really don't know that your cholesterol is high. And controlling cholesterol and modifying it and treating it aggressively earlier on is what's important to preventing cardiovascular disease. That, along with blood pressure, are the two major risk factors in cardiovascular disease. And when I say cardiovascular disease, I do mean strokes and heart attacks. And the major thing to do is, much like high blood pressure, is that you get screened annually. Typical recommendations and guidelines that we usually start screening around age 30 or 35. One of the first lines that, particularly on our lab test, is what's called the total cholesterol. Total cholesterol is just the overall number that looks at your body's amount of cholesterol, and then it breaks it down into several different categories. LDL is what we call low density lipoprotein, and that is what we typically refer to, at least in my practice, as the bad cholesterol. The higher that number is, the higher the risk factors that you have for cardiovascular disease. HDL, which is what we classically refer to as the good cholesterol, and HDL cholesterol kind of helps mitigate and balance out the total cholesterol and the bad cholesterol. It can help with higher numbers to reduce your risk of cardiovascular disease. For most people, what we typically want to look at is the total cholesterol and the LDL, just for the average individual. So total cholesterol numbers less than 200 and certainly less than 150 can be targets in individuals. The LDL, or the bad cholesterol, if you've never had a cardiovascular event, we typically try to shoot for under 100. Lifestyle modification is very important. So smoking cessation, weight reduction, proper diet. There's the Mediterranean diet, which is kind of a low-fat diet. Cardiovascular exercise are some of the things that the patient can do that doesn't require medication. If they don't reach those targets after that, then we begin to start talking about certain medications. One of the mainstays and one of the staples to treat that is medications called statin drugs. Physicians know that if you're taking your medication on a regular basis, we will see significant improvement in your cholesterol numbers.